Good morning, everybody. This is Dr. Ilisse Perlmutter. I'm the chair of Behavioral Health and Addiction Services at Bergen Newbridge Medical Center. And I'm pleased to talk with you today about some of the issues we are all having in dealing with the coronavirus pandemic and its mental health sequelae, symptoms, and aftermath. It's not a sprint, it's a marathon, and that's something we all need to keep in mind. So our objectives in this discussion are to understand the psychological and behavioral health impacts of pandemics and other disasters on individuals and communities. We need to be able to recognize which groups are vulnerable to the adverse effects of COVID-19, focusing on patients and the healthcare workforce. And finally, we should be able to describe interventions to help manage the unique challenges presented by COVID-19. So let's talk for a few minutes about the psychological and behavioral effects on individuals and communities. What is a disaster? We use that word a lot. A disaster is an event that overwhelms a community. There are various types of disasters. There are natural versus man-made. For example, a man-made disaster would be the terrorist attacks of 9/11, the mass shootings that have gone on in the last number of years. They differ in severity. Some are predictable, some are expected. And they're central versus peripheral. What does that mean? That means that a disaster might occur inside a community and negatively impact on its members, as opposed to what we've been experiencing in the last few months, a peripheral disaster which has come from outside and then basically invaded concentric circles of the population. There's a cycle in disaster psychiatry, and we call it the cycle of disaster psychiatry stages. Different articles will define this differently, but for our purposes today, we're going to talk about the pre-disaster stage, which refers to general planning and training, emergency management. There's no way that we prepared for the pandemic that we're now experiencing, but certainly having a disaster impact on either a smaller community or what has happened now, really our global community, was not out of the question. And planning would involve stockpiling supplies, talking about shelter, hospital beds, equipment, and training. An acute disaster stage really talks about the actual impact, if you will, which for us here, certainly in the New York, New Jersey area, occurred in early April. There's a subacute phase in disaster psychiatry, and that really refers to the time when things are starting to improve a bit, people can catch their breath, so to speak, take stock, and it's often at that particular stage when we start to see some of the mental health effects of what has occurred. It's really a time when we refer to the response stage. People are starting to not just react, but to think about what has happened and what they're going to do for themselves, for their family, for their community. Then comes the chronic disaster stage, and that's really more of a stage of recovery. We're not there yet, although we're beginning with respect to COVID-19. But that's a time when people really pick up the pieces, try to improve, make things better, and move forward. Finally, there's post-disaster stage in disaster psychiatry, and that refers to mitigation, trying to contain whatever's impacting on the community, reviewing assets. In this case, we're talking about jobs, employment, and certainly, most important of all, the loss of life. This is another slide that gives a pictorial version of the categories of disaster. And again, you can see that there are natural disasters versus human-generated disasters. And the human-generated disasters can be non-intentional or intentional, as in mass violence and terrorism. They can be technological. For those of you who can remember back to the 1980s, there was 3 Mile Island, a nuclear power plant that leaked. That was a human-generated but non-intentional disaster. That's an example of that. Then, of course, natural disasters, we're talking about meteorological, hydrological, the wildfires, geological, and now the pandemic. The major principles in responding to a disaster are, in one sense, the same for all age groups. We have to meet basic needs. And what are those basic needs? It seems very, very intuitive and simplistic, but in a rush to respond and manage a situation and to react, it becomes very easy to forget that for anything else, we need to make sure that the common human needs are met. That's food, water, shelter, safety of one's family, and acute medical care. Those of you who have seen the response to various disasters, either locally or on television, will often remember the big white Red Cross trucks with the big Red Cross on the side and the volunteers coming out with coffee and cookies, very simple type of things, but they're the ones who will respond all over the country right at the beginning of a disaster and provide those kinds of basic human needs. Let's talk a bit about the footprint of a disaster. The psychological and behavioral effects of a disaster are experienced by a larger number of people over a greater geography and over a longer period than all of the medical effects combined. Think about that. It's very important for planning and to be aware that there will be increased mental health needs after a disaster. Think of some of the things that we've endured and experienced in recent years. There was 9/11, Hurricane Katrina, the Newtown school shooting, the Las Vegas shooting. The mental health sequelae was immediate, but it also continued, sometimes surfaced later on, and lasted for years in many, many cases. In planning to respond to a disaster, these are things that we have to think about because the effects of what people experience impact them for a very long time. So let's talk a little bit about the response to disasters. There are psychological and behavioral responses to disasters, and in this case, a pandemic. Now, psychiatric disorders make up a significant portion of the morbidity and mortality associated with disasters. But before disorders, true disorders or illness occurs, and with greater frequency, the public experiences the stress reactions and often engages in health risk behaviors. What are some of these reactions? Sleep difficulties, decreased sense of safety, physical or somatic symptoms, irritability or anger. And what are those health risk behaviors which overlap? You can see by the overlapping circles on the slide. People will often drink too much, smoke, use or misuse prescription medications. Families can be in great distress. We see an uptick in interpersonal conflict and domestic violence. There's a big disruption in work-life balance, and activities are restricted along with travel. It's important to consider that whether or not someone has an alcohol use disorder, the increased use of alcohol is associated with a wide variety of adverse effects, such as medical errors, accidents, family conflicts. And when these issues show up in healthcare, it's typically in primary care and emergency room settings, not necessarily a psychiatrist's office. They're also seen, as I'm sure you know, in law enforcement and social services. This really underscores the importance of building and sustaining partnerships among healthcare specialties, as well as with other professional disciplines. We have to collaborate and really partner with the other professional organizations or systems that take care of the public. Certainly, the psychiatric disorders that we see the most are depression, post-traumatic stress disorder, anxiety, and complex grief. However, it's really important to remember the vast majority of us are resilient and will do well. It's also important to remember and keep in mind that reactions to trauma may appear immediately during and or following traumatic events, but they may not occur for days, weeks, or even years. In certain cases, such as frontline healthcare professionals, isolating their emotional reactions is paradoxically a protective and necessary mechanism to enable them to do their jobs. And the feelings can then later appear and overwhelm. You can imagine for the staff going into the intensive care unit or treating one COVID patient after another, going from one ventilator to the next, to really stop and reflect on the pain their patients are suffering, the pain the families are suffering, the fear and the compassion that they themselves are experiencing. That can be overwhelming when the task at the moment is to really try to save and take care of their patient medically. It's later on, in quiet moments, in reflective moments, when some of these emotional reactions surface. There are unique public responses to pandemics. There's fear and uncertainty. If you read the paper today, take a day and read the front page of the newspaper of your choice. A lot of it will be factual, but there will be plenty of articles that talk about the fact that the future is still unknown. With pandemics, we have the potential, and we're living it, for isolation and quarantine. There can be shortages and scarcity of equipment and of treatment. Misinformation spreads rapidly, and people become more upset. There can be anger, stigma, scapegoating. There have been reports of people who became ill with COVID-19, recovered, and then were stigmatized and scapegoated by their friends and family. We see faltering confidence in government and institutions, and that's happening right now. There's a surge in healthcare demand. It's very important to remember that an altered perception of risk, not necessarily what the data shows, but a perception, an altered perception of risk results in specific behaviors. And those might be some of the behaviors and the distress reactions that we spoke of a few minutes ago. We have to consider the impact on patients and society. And what are the disorders of trauma and loss, heightened stress, decreased access to care, and overwhelming loneliness and uncertainty? And certainly, we see mood disorders, we see depression, we see anxiety disorders, post-traumatic stress, we see alcohol and substance use disorders. So these are things to be aware of and to identify, and if need be, to intervene early. COVID-19 is definitely affecting our mental health. It's transformed everything we thought we knew about our daily lives, our government, and our health. Social distancing is the new normal. Even sheltering in place, quarantine, all the institutions that form the structure of our daily life and who we are have been closing. Schools, jobs, stores, restaurants. And virtual reality is the current new normal. Now, those individuals who suffer from anxiety, depression, post-traumatic stress, psychosis, substance abuse, and other symptoms of chronic psychiatric illness are some of our most vulnerable people in terms of loneliness, isolation, and potential for self-destructive behavior due to a lack of consistent support and a disrupted routine. Some common examples that you might see or even experience. In the area of anxiety disorders, those individuals who are challenged with anxiety disorders may find that the COVID-19 pandemic can create an elevated fear of catching or dying from the virus. It's easy to manage, it's easy to think the worst and manage anxiety by either holding up, withdrawing, drinking. What's important to recognize is that there is no such thing as having no fear. That's a common human experience. So some of the things that can be helpful in coping with anxiety is to do measured, deep breathing, use mindfulness, cognitive reframing, and most important of all, limit the media diet. Another very common set of symptoms is the area of depressive disorders. During the pandemic, fear and isolation without outside influence to balance with some positive things can easily lead to a focus on the bad news and a growing sense of hopelessness or fear. Loneliness and fear can be triggers for suicidal thoughts. So to cope with depression, it's important to focus on connection and self-care. Keep to a routine. People get up at such and such a time. They have breakfast. They either read the newspaper. They exercise. They go for a walk. Whatever it is. But that structure is really very important for keeping a balance in mood. Do something so that you act as if you're feeling positive. That sounds crazy. But there is a construct in psychiatry and in mental health that's been replicated for years for people who are just stuck in a rut, depressed, can't get out of it. Act as if you're having a good time. When you do that, when people do that and they do it repeatedly, that feeling of wellness, of connection, becomes internalized so that the act actually morphs into reality. It's not an act anymore. People are able to experience happiness and positivity. Substance use disorders present a big challenge for us, and we know that they are frequently comorbid, coexisting with other psychiatric illness. Certainly during the pandemic, with people being isolated and upset and worried and anxious, there's a big concern for the risk of relapse, especially because right now with people really having to stay largely at home, they are unable to attend daily support groups or daily meetings, which is really the backbone of substance use treatment. Addiction is treatable, but treatment is not generally alone. Think of Alcoholics Anonymous, Narcotics Anonymous, and 12-step programs. They are tried and true. So it becomes a challenge in this situation to continue with one structure and to connect with other people. During the pandemic or a disaster, in coping with a substance use disorder, It's important to find a recovery mentor or sponsor, coach, or therapist with whom one can connect. And with that individual, to talk about the 4 major points of connection. Everything that's happening, and that's what you're feeling in the moment. If an individual is having increased cravings or needs to talk to somebody, try to avoid isolation. Give oneself daily talks, a pep talk, if you will, to remind oneself what happens if you give in to those cravings. And talk to oneself about everything good that can happen in the future and identifying what the triggers are for cravings in order to take the power from the substance and put it in your own hands. So in caring for patients' mental well-being and for understanding what we might feel ourselves, it's important to stay informed, to educate as to what is happening, what is real, what is conjecture, what is rumor, to correct misinformation, and again, to limit media exposure. It's important to anticipate and counsel about any stress reactions, but also to acknowledge that stress exists in the situation and help normalize it. And teach patients to recognize signs of their own distress. Now let's talk a little bit about children and adolescents. During any stressful situation, a disaster, a pandemic, there can be certain observable changes in behavior. Now, that doesn't mean that these are psychiatric illnesses. These are expectable and anticipated responses to a stress. In these kinds of situations, children are often separated from their primary attachment figures. Parents can be distracted and preoccupied and worried. Schedules and routines are disrupted and go out the window. Everyone is afraid. Feelings of safety start to erode. And either parents or children can blame themselves and feel helpless. So what do we see? With children, certainly, and maybe some adults, when an unusual, outside, overwhelming disaster, stressor impacts, children regress. So the milestones and the more mature behavior they had been exhibiting goes out the window. That doesn't mean it won't come back, but regression is a normal and expectable response to overwhelming stress. School performance may start to diminish. Children become aggressive and they fight with their siblings, with their parents, with each other, and can blame themselves. We saw a lot of this when we took care of children at the Family Assistance Unit after 9/11. And it was in almost every child we saw. Children's reaction to trauma follows a particular pattern. There's fear for oneself and one's body integrity, worry about parental safety, there's separation anxiety, being separated from parents or caretakers. When bad things happen, it's easy to lose trust in adults. Adults are the ones who are supposed to protect them. There's a refusal to follow routines, mealtime, bedtime, whatever it is, temper tantrums. There can be antisocial behaviors, what we call vegetative or physical signs, typified by a problem with sleep or eating, withdrawal, and as we said a few minutes ago, regression. So how should we respond? Don't avoid talking to children and teenagers. Try to understand their perceptions and create an open and supportive environment where they know it's okay to ask questions. We always say, don't just do something, stand there and listen to them. It's important to be authentic, to be honest, to be reassuring without making unrealistic promises. The other thing that's really important to remember in dealing with children and adolescents is to remember that everything is developmentally driven. What we would talk about with a 3-year-old is not the same as what we would talk about with a 10-year-old, which is not the same as a 15-year-old, and not the same as an 18-year-old. Just to review age-related hallmarks, infancy is classified as birth to 2.5 years, preschool 2.5 to 6 years, school age or latency age 6 to 12 years, and adolescence 12 to 18 years. So people say, what should I say? It's important to explain what the coronavirus is. And here are some examples in how you would approach this with various age groups. For preschoolers, the little munchkins, you might say that coronavirus is a new germ, and germs can spread from one person to another. For school-age children who are notoriously and wonderfully curious, we might say that it's a new germ that spreads from person to person like a cold, because they know what that is. For teenagers, it's important to ask them what they already know from social media, from the TV, you name it, and explain that it's a new virus, one that humans haven't experienced yet, but that scientists are now working on medications to treat it. Obviously, self-protection is one of the hallmarks of dealing with this pandemic. So, for preschoolers, we might say, when we sing the alphabet song while we wash our hands, we make sure we wash long enough to get rid of any germs. For school-age children, we make it harder for the germ to spread by washing our hands often, coughing into our elbows, and not touching other people. And for adolescents, the coronavirus spreads more easily than other viruses, so we need to wash our hands more frequently, especially after coming into contact with surfaces in public places. It's also important to explain how we protect others who might be at risk. And for small children, now even though the germ won't hurt you, it could hurt older people like grandma and grandpa. For school-age children, the virus doesn't usually make people your age very sick, but it can be dangerous for older people and people who have other illnesses. And then for the teenagers, the coronavirus is less likely to make young people very sick. You can still spread the virus to others who are more vulnerable to it and who could get very sick or even die, such as older adults and individuals with other illnesses that cause them to have weakened immune systems. And there are lots of ways to communicate this. These are just examples. Some of the resources I'll give you at the end of our discussion list and give you scripts for things you can say. And it's really in your own words, as long as it's at an intellectual, developmental level that the youngster can understand. So this is a slide that comes from this medical center about helping children cope. I'll leave it on here for a minute so you can take a look at it, and you can always go back. But certainly staying calm and positive, and always following a child's verbal and nonverbal cues is critical. Limit overexposure to the media and social media. That goes for every age group. And be reassuring. Be present and in the moment, and actively listen and support them. Also, especially with everybody, for example, in one house or an apartment, it's easy to forget that children are listening. Save the adult conversation at a time when children are out of earshot if it's things that they should not be hearing. And also, try to make time for everybody to unplug from their devices. Let's talk for a few minutes about the media, which is wonderful and terrible. We know that the media is critical. We need to know what's happening and how to deal with things and how scientists are working on a vaccine. The media is fantastic because it really is important to enhance the dissemination of timely and accurate information. But the flip side of that is that it can enhance transmission of fear and distress. So it's not all one or the other. Thinking about factors that influence our community, the media, as we know, plays a very significant role. It's an important source of health information, and it shapes both public perceptions as well as our subsequent behaviors. But it can also transmit fear and distress. Research has consistently found that increased exposure to disaster-related media is associated with elevated rates of insomnia, alcohol use, depression, post-traumatic stress symptoms, and general psychological distress. And the research is not necessarily from now, the pandemic. We're in the middle of this. But it alludes to studies that have been done for years on psychological and behavioral reactions to various disasters, going back to the 1970s when there was a series of children being kidnapped in a school bus. They were all rescued, but they were traumatized, and people who had seen the reports on TV had what we call secondary traumatization. And that was all really from the media. Certainly 9/11 and the pictures of flat planes flying into buildings. So it's really like taking medicine, I think. It has to be given at the right dose. And we need to titrate what that dose is going to be for ourselves as well as for our children. Let's talk for a moment about the reactions of the frontline and essential workers, our heroes and heroines. The varied roles one may assume in a disaster, and in this pandemic in particular, can undermine role definition, which is really the foundation for handling stress, knowing who you are and what you're supposed to do. Certainly right now in the pandemic, many healthcare workers have been redeployed to areas not in their purview. For example, many first and second year residents in various institutions who were in psychiatry, anesthesiology, pediatrics, surgery, were mandated and deployed to work as interns, not on their own, obviously, but to help the medical staff in the ICU and in some of the emergency rooms. Some have found it overwhelmingly gratifying, and some have found it terrifying. It takes away from the things that they thought about themselves, and becomes easy to become unsure and question one's ability to help. The overwhelming nature of the situation can lead to anger at the unfairness of things and guilt from an inability to address immense needs, or in this pandemic, guilt from not being on the front line oneself because one is trained in other areas. In order to do this work, caring for overwhelming numbers of critically ill patients and with the fear for oneself and one's loved ones, the emotions are often isolated, pushed away, so that one can continue to function in his or her role. Healthcare workers face unique challenges during the COVID-19 pandemic. One of the things is that the health and safety of one's workplace and home becomes put into question, especially in some of the facilities where there was overcrowding, which is many of the facilities during the ramping up of the amount of cases, the number of cases in this area. The lack of adequate protective gear until it arrived, and then being concerned about going home and possibly infecting one's loved ones, so that many healthcare workers were staying in other places or being isolated. Again, we spoke a little bit about working outside the scope of one's practice, which is very disconcerting. The stigma received from family, friends, and neighbors, altered home and work processes and dynamics, evolving policies every day as we learn more, fatigue, frustration, while we wait for the next wave. So this is already taking a toll, and we know that many of our frontline workers across the country are struggling with depression, anxiety, insomnia, and general distress. So it's important to be aware of that and to be proactive in reaching out to help. When this pandemic becomes under better control, it's possible that we will see a mental health tsunami as the immediacy and the intensity of having to care for very, very sick, critical patients starts to dissipate a bit, and a lot of these emotions come back or surface. So the healthcare worker challenges are enduring and emerging all at the same time. What should we do? Basic self-care is very important. Eating on a schedule when possible, exercise, sleep, whatever it is that makes an individual feel good. Limit exposure to the media. Make sure that one does everything possible for personal and family safety. One of the things that make this particular disaster different in some ways is the exposure to human remains. And because the exposure to human remains and mass death, which is what has happened in this situation, come with their own psychological effects. There's a novelty about the situation and concerns about contamination, and that can certainly amplify distress. The whole issue of death notifications is fraught with incredible emotions. Most people are not prepared for this, and it's a huge responsibility because notification to families often has significant lifelong effects, both for the family members receiving the news and for the person who delivers it. When done poorly, it can exacerbate grief, but if it's done with sensitivity and correctly and with compassion, it can help in recovery. There have been disrupted dying rituals. The irony is that in times of illness and death, humans have a hardwired nature to come together, to support each other, to be there for each other, regardless of one's spiritual orientation. We see it in most every ethnic or religious group. And now it's done with a couple of family members standing far away from a grave and on Zoom. And this is very, very difficult. We grieve as a community by the overwhelming number of people who are sick and who have been lost. And it's, I think, especially hard for people who are on the front line, who are really doing heroic things to try to keep people healthy. What we also hear is the overwhelming fatigue, physical and emotional. So it's very important to try for us to try to help and intervene for our front line. Organizational and social factors for sustaining healthcare workers in outbreaks are very important, and that's done through timely training, providing effective equipment and training people how to use it. The camaraderie of colleagues and managers is very important, so people feel that support. Some of the departments I spoke with have a buddy system where say one nurse checks in with another at the same time every day. People are paired up so that we try to prevent some of the isolation. Communication, regular updated information is very important. Preparation for a range of exposures has to be taught. Education about what normal reactions to this can be very, very helpful, along with resources to help mitigate reactions and distress, and also reminding people that most of us are resilient. We try to provide support through web-based or in-person informational sessions, and again, to prevent isolation. Finally, we want to support people now because it's important to remember that there is a future, and we need to look to the future. In psychiatry, we know that words have power, both what we say and how we say it. So it's very important to provide good communication and clear messaging during the pandemic and in any disaster. Communication is really seen as an antidote for distress. It's important to understand that, for example, we can talk about being concerned rather than being panicked. We can talk about being prepared with what we need versus hoarding face towels and paper towels. Normalizing our experience is very calming and connecting. People start to think, I'm crazy. No, you're responding to an incredible stress. It also recognizes the varied expressions of uncertainty, influence of organizational behaviors and recovery. And it's really, really important to acknowledge, encourage, and respect rituals and symbols because they go really beyond the written and spoken word and help a form of communication that goes beyond the written and spoken word, especially at a time like this when so many of our cultural and social rituals are being disrupted. For example, social distancing. During a crisis, the tendency, the reaction is to be together, and here we're told to stay apart. Rituals and symbols often have the power to bridge divides, create connections, and offer a form of healing really far beyond the spoken word. And without words, they really encourage the recognition that we are in this together. So in responding to stress during an infectious disease outbreak, we can see, again, to review, fear and worry about our health and that of loved ones, changes in sleeping or eating, difficulty in sleeping or concentrating, worsening of chronic health problems, worsening of mental health problems, and the increased use of alcohol, tobacco, or other drugs. We need to take care of ourselves. Organizational strategies are crucial. Clarification of roles, clear schedule of work hours when possible, and the understanding and emphasis that emotional reactions are acceptable. Individually, it's hard to take breaks from watching, reading, or listening to the news, including social media, but we really have to do that. We have to have an unplugged session. We need to take care of our bodies with relaxation, medication if necessary, eating well, exercising, and adequate sleep. Making time to unwind, and above all others, connecting with others, be it on the phone, be it in a drive-by waving from the car, depending on where you live, or through the miracle of modern technology. We have to cope together. And again, this is a slide from this hospital, which reiterates some of the things we just said about exercise, eating well, limiting media exposure, washing our hands often, do activities and connect virtually with friends and family, and take it day by day. Finally, through it all, we need to instill hope, and that's a delicate balance. Our challenges right now are real. We have problems to be managed, losses to be counted and acknowledged and mourned. Pain needs to be felt and grief has to be honored. Yet, we have to know and look to the future and remember that this will eventually end. Most of us will do well. We need to recognize and amplify what's good in our lives, look for good opportunities, and maintain hope in the future. Look to our communities, to organizations, neighborhoods, and our families, and remember that we are all in this together. I want to thank you all for watching. I want to give special thanks to Dr. Joshua Morgenstein, who's a captain in the United States Public Health Service and the assistant chair at the Department of Psychiatry at the Uniformed Services University of Health Sciences in Bethesda, Maryland. And I've given you 3 really excellent websites that have things right on their homepage. The first is the Center for the Study of Traumatic Stress, where the really pretty slides you saw came from. Those are courtesy of Dr. Morgenstein. The American Academy of Child and Adolescent Psychiatry, www.acap.org. On their homepage, you will see on their left-hand side links for Facts for Families. It's public domain. Just click on that, and you will find all kinds of resources that help in helping children deal with stress and trauma. And finally, the American Psychiatric Association, www.psych.org. Their homepage also will have many links of useful and important information in dealing with mental health issues, specifically to the COVID-19 crisis. And thank you all very, very much.